Please start, Dr. Handan.
Good afternoon, dear all participants, dear Jeongmi, GENOSYS, and all around the world, different headquarters. This is Dr. Handan Yavuz speaking from Istanbul. It's nice to be here today to come together for having a short brief about the hair loss treatments. And I wonder the participant, in fact, so that's why I asked Jeongmi to inform us from the chat box how many of the participants are medical doctor, how many of them are aesthetic practitioner. I wonder it because according to this information, I will try to reorganize my presentation. And you can write all your questions and comments from the chat box to us. We will try to make an interactive presentation. It is very important. So now I'm starting, my dear all. We all know that hair loss is a common dermatological condition that affects men and women for all ages. We have got young patients, we have got old patients, we have got male patients, and we have got female patients. And okay, we all know that even we are a medical doctor or an aesthetic practitioner, hair loss, alopecia, is not a life-threatening condition. However, we again all know that hair has got really, really big, significant physiological, psychological, and social impact on the quality of life. Here you can see many famous women, men, and group. But when we just pronounce the name of Elvis Presley, for example, we can remember him with his hairstyle. Or when we say Beatles, when we say Marilyn Monroe, when we say Diana. So which means that the hairstyle, hair quality, hair presence is a really important, has a really important effect of our image. So that's why many people who has got hair loss problem search a strong treatment options. And that's why the scientific improvements are very important for the hair loss treatments. Now, we all know that for the hair loss, we say that it's alopecia. Alopecia just means that hair loss. In general, we say that androgenic alopecia. It is the most common version of the alopecia. There are different kinds of alopecia, but in general, most of the patients has got androgenic alopecia. It differs according to the races, but the alopecia, androgenic alopecia, has got really a high prevalence. For example, we know that 57% of the women are affecting during the lifetime period from androgenic alopecia. And this ratio is higher for the male. Here, approximately 25% of the males are affecting from the androgenic alopecia. So today, during my presentation, I will try to explain a short review for all of us, just to remember about the hair anatomy, histology, what's going on the hair cycle, the biochemical structure of hair, and how our body, how our physiology controls the hair growth. We know that for the hair anatomy, there are 3 segments. The lower segment of the hair under the scalp is bulb, and just above it suprabulb. The middle segment is isthmus, and the upper segment is infundibulum. So let's go a little bit in deep. Now, probably the presentation is possible to see from your side. And now I'm pointing here. Here is the bulb part. So bulb is very important part of the hair. Whatever treatment we do, we try to reach to the bulb. We try to affect the bulb differentiation. We try to improve the bulb relation with the stem cells. So the bulb is the starting point of everything for a hair growth. Isthmus part is between the bulb and the sebaceous glands. So here we know that there are hair follicles that has got single ones, double ones, and triple ones. But whatever it is, the bulb is very important for all the hair life cycles. So we know that the single grafts, according to this bulb, there are sometimes when we take a cut from the hair, the units with healthy bulb sometimes has got single follicles, and these are in generally present at the front hairline, and the donor area or the other side of the hair has got multiple follicular units. It can be double, triple, or more. So when we look at the histologically, here we see that on the middle there is medulla, then there is cortex, here is the bulb, but just across the cortex, we have got hair cuticula. So now we have got a horizontal segment of the hair follicle. We can see here again the medulla, the cortex, and the cuticula of the hair follicle. Here, what is important for us when we are talking about the histological structure of the hair? We know that hairs are keratinized structure from a result of invagination of the epidermal epithelium. Color, size of the hair, all these are changed. It depends on our age, it depends on our race, gender, and body part. The quality of the hair at the donor area or at the vertex or at the front side are not same, but also it is not same on the different body parts. On the chest, the male especially has got hair follicles, and their structure is totally different from the hair that is present on the scalp. So when we look all our body, approximately we have got 5 million hair follicles. We have got hair follicles also on our arms, but we want them not to be visible. So the skin surface of an adult human covered with approximately 1,000 centimeters square. Today, when we talk about the hair, we mainly focus on the scalp hair. And when we look at the scalp, this information that I highlighted with the yellow color is very important. There are approximately 100 hairs per centimeter square. So in our hair scalp, when we draw a small 1 centimeter square, if you say that this patient, this consultant has got a healthy hair, this means that they have got 100 hairs there. But this doesn't mean that they have got 100 hair roots, hair grafts there. Hair and roots are something different. Some previous slides ago, I highlighted that one hair root can be triple, double. So if you have got 100 hairs per centimeter square, then we need to divide it approximately 2.3 to understand that how many hair grafts are present in 1 centimeter square. So when we just divide the 100 hairs to 2.3, it is approximately 40 or 45 hair roots or hair follicles are present there. And when we think with the thousands, because for a normal adult, on the scalp, not in 1 centimeter, all scalp area, a normal adult has got 1,000 hairs. So for the 1,000 hairs, this means that 40 or 45,000 follicles are present on our scalp. So this is very important because when you are informing your patient, you will say that we will stimulate the follicles, we will stimulate the hair grafts, but you will have more hair. So when you stimulate 1 centimeter square at the grafts level, hair follicles level, you will appear 100 hairs approximately. That's very important. So now let's continue to the hair cycle. Now, as you see here, the hair bulb, isthmus, and the rest of the hair. Let's see how they grow up. In fact, we have got 4 different phases. This is anagen phase, catagen phase, telogen phase, and exogen phase, which means that we lose the hair. Today, let's start with the anagen phase, because this means that it is the hair growth phase. This is very important. During the anagen phase, we have got rapid proliferation in the bulb at the hair follicle. Hair root differentiation is very strong, and everything we do is, in fact, our target is to increase the anagen phase of the hair. There are many hair follicles on our scalp. Each hair graft is not at the same phase. Some of them are at the anagen phase, some of them are at the catagen phase, some of them are at the telogen phase. So our target during all our treatment to increase the number of grafts that are at the anagen phase, because at the anagen phase, we know that hair growth is stimulated. So at the catagen phase, it is resting phase. So there's a proliferation growth phase, anagen phase. Then the hair continues with the resting phase we named as catagen phase. During this phase, the hair is not proliferating anymore, but we know that differentiation is getting slowed down. Now the hair bulb, hair formation was at the anagen phase. Now it's time for to create hair clump. So dermal papilla remains in the contact with epithelium still, but it is not as strong as the anagen phase. From anagen phase to catagen phase, we know that proliferation is getting slow, and slowly, not severely, but slowly apoptosis begins and differentiation is slowing down. So the main proliferation, main differentiation, main formation of the hair appears at the anagen phase, and then it is getting slowed down at the catagen phase. And when we look at the telogen phase, we know that club hair is stabilized, apoptosis ends, dermal papilla is not related with the club hair, and hair follicle is silent. Now it is passive. So telogen phase is very important for us. We know that if we don't have enough support, if we don't get a stimulation after the telogen phase, it will continue with the exogen phase, which means that club hair loss is present. So our main target is, okay, anagen phase is physiologic, catagen phase is physiologic, and telogen phase is physiologic. But if it is possible for us from telogen phase to start the hair follicle immediately to the anagen phase, new hair formation will be stimulated. Exogen phase is also physiological. Whatever we do, what kind of treatment we do, of course, we will lose some of our hair. But our target during our treatment is to decrease the number of exogen phase follicles and to increase the anagen phase of the follicles. So, from the telogen phase, our target is to go to stimulate the hair for the anagen phase. Because we know that if we can succeed this, the stem cells are activated, cell near the dermal papilla proliferated, and it is possible to push the formation of hair bulb. And so let's see what we can do more to increase the anagen phase roots. Because here you see the anagen phase, look, bulb, isthmus, and the rest of the hair. But with the catagen phase, the connection with the dermal papilla, remember here, was decreasing. So hair shaft differentiation was slowing down during the telogen phase. Now our target is when the hair is at the telogen phase, immediately to do a treatment, and before the exogen phase, before we lose the hair, let's start a new impulse and come again to the anagen phase. So this is the hair cycle, our anagen phase, our catagen phase, telogen phase, and exogen phase. If we do the treatment strongly, successfully, then the hair roots that are at the telogen phase or exogen phase immediately comes back to starts to the anagen phase. So we will not have any empty period at the bulb. So we know that the main chemical substance for the hair is keratin. But don't forget that even the keratin is very important. We need also enough water. We need also enough amino acids, phospholipids, fatty acids near keratin for a healthy hair. So keratin is very important. Let's concentrate on this presentation between the keratin and the amino acids. Keratin that make up hair proteins with different structures and molecular weights, and they are rich with some amino acids. What are they? Serine, cysteine, arginine, and methionine. So what is important from here, when we are choosing a hair mesotherapy product, we should be sure that that product has got biotin inside it and also cysteine or arginine inside it. This is very important for us. So we know that for these hair cycles, hair growth cycles, there are other important factors like hormonal factors, like neural factors. If the patient has got hormonal imbalance, this directly affects the quality of the hair. Not only at the scalp, all body, but we concentrate on the scalp today, especially the thyroid hormone, especially the estrogen hormone during menopause. It is very severe, very important for the hair quality. As you can understand from here, I'm not talking only about the androgens. Okay, androgenic alopecia is a great problem for us. Most of the patient has got androgenic alopecia. But don't forget that, especially the three hormones that I would like to highlight, estrogen, thyroid hormone, and cortisol hormones has got strong effect for the control of the hair cycle. You cannot stop the effect of androgenic hormones effect on the androgenic alopecia. But if your patient has got some thyroid problems, some cortisol problems, some estrogen problems, then the androgenic alopecia of the patient becomes more and more severe. And so we should have a holistic approach to our patient. Only to say that this hair loss is androgenic. So what can I do as a medical doctor, medical point of view? This can restrict our success. Now, at the second part, we will see there are different kinds of alopecia, as we mentioned at the beginning of the presentation. I will make a short review for the different kinds of alopecia, different classification of androgenic alopecia, and then what is hair checkup? Why hair checkup is important? Let's have a holistic approach. Okay, we know that alopecia is the medical term of hair loss, the partial or complete absence of hair from areas of the body where it normally grows. Alopecia can be localized or diffuse or permanent. It can affect both sexes and all groups. Several factors like autoimmune or inflammatory disease or infectional disease or hormonal factors or sometimes physiological factors or sometimes neoplasms can affect alopecia. But sometimes we have got alopecia problem, so that can appear with the scars. So you can divide alopecia according to scar alopecia or non-scarring alopecia, or you can divide the different kinds of alopecia according to the autoimmune alopecia, inflammatory alopecia, or physiological alopecia, or neoplastic alopecia. So scarring or non-scarring alopecia, we have got different classification. But for a short review, androgenic alopecia is a non-scarring alopecia, which means that there is no scar problem. If the patient has got neoplasma, if the patient has got an infection, if the patient has got an accident, then scarring alopecia can happen. But most common patients that we see are androgenic alopecia, and here there is no scar. It is non-scarring alopecia. And this is the most common problem that we all come face to face. So I don't care so much if it is inflammatory alopecia, if it is hormonal alopecia, if it is scarring alopecia or non-scarring alopecia. I just would like to today concentrate on the androgenic alopecia and the holistic approach to the androgenic alopecia. Okay, this is a general slide. We know that androgenic alopecia is very common. In fact, it is common both for the man and woman, male and female. So, but in general, we say that male pattern alopecia or female pattern alopecia, but it's again androgenic alopecia. It doesn't differ. So, androgenic alopecia, the main component here is genetically detectable. So the key pathophysiology for the androgenic alopecia, we know that here we see that at the pathophysiology. Remember the hair anatomy, hair histologically hair root. The normal development of the different phases are affected here. We know that most of the hairs are at the telogen phase. If the patient has got an androgenic alopecia, they are at the telogen phase. The hair roots, most of the hair roots are at the telogen phase. And even most of them are at the exogen phase. The patients are losing their hair. Their hair is not growing, which means that maybe at the catagen phase, but we are all sure that at the androgenic alopecia, anagen phase, the proliferative phase of the hair becomes shorter. So the catagen, the telogen phase is more at the hair follicles, and we are losing hair. And in generally, from the pathophysiological features, we see that there is a strong inflammation there. So the hair follicle getting weaker and we lose the hair. And in general, what we see here in the androgenic alopecia, in the frontal area, in the mid-scalp area, or the vertex area, we are hair, both in male and female. Of course, there are similarities between male and female, but let's highlight that in men, it is typically starts from the frontal hairline, and then frontal and vertex become thinner, and hair in the occipital area or just near the ears still healthy. When we look at the woman androgenic alopecia, baldness does not occur to a severe degree. It's a little bit different. In female androgenic alopecia, there is a typical progressive thinning at the central part. So in the men, in the male, they start from the left and right frontal area and the front side. But for the woman, we know that it started from the central part. So this is, in generally, starting is a little bit different, but we can see that for the woman, if the women are healthy, they can keep the frontal hairline, but here, like in tree, they have got hair loss. So there are different classifications. Here you can see the Norwood and Hamilton hair loss stages. And this is the Ogata's androgenic alopecia scales. And this is Bona androgenic alopecia classification. Look, this is the female pattern androgenic alopecia. For the woman in general, it starts from the top like a tree here, you see, and then it generalized. So all these are giving us an idea. And this is, again, the point that I would like to explain you. The temporal frontal angles and the front side are, in general, for the male, the hair loss starts from this part. But as a result, whatever it is, female or male pattern androgenic alopecia, we all know that androgens are very dominant for the androgenic alopecia. But there are some other factors. Genetic factors, age, and growth factors are also has got an important complex role for the formation of androgenic alopecia. We all know that dihydrotestosterone hormone as an androgen is very important for the hair loss. there is the receptor at the hair roots, hair grafts, for the dihydrotestosterone hormone. We name this receptor as an androgenic receptor. So hair roots has got an androgenic receptor. Androgens, the dihydrotestosterone hormone, for example, is present on the blood. With the blood circulation to the hair roots, the dihydrotestosterone is combined effect with the androgenic receptor. And if there's a genetic predisposition, we know that the androgenic phase of the scalp of the hair root is affected. So the hair cannot proliferate enough, cannot differentiate enough, and the hair loss appears more and more often. We know that androgen hormones are steroid hormones that are necessary for the formation of male phenotype and secondary sexual characteristic of pubic, arm, and facial hair growth, and of course muscles, so which means that they're essential. Steroid hormones show their effect by binding the intracellular receptors and forming a hormone receptor complex. Since androgens are steroids, they must bind to various receptors within the cell in order to show their effect. But if androgen sensitivity and distribution of androgen receptors on the scalp are region-specific, then we can see androgenic alopecia. So this explains why only the hair on the crown and temples is completely lost, but not the hair at the occipital region. Here, what I would like to say that each receptors of the hair are not same. Some of the hair follicle receptors are sensitive to the androgen. Some of them are not sensitive. So androgen is the same androgen in all our body, male and female. Androgen hormone, dihydrotestosterone is same. It doesn't affect this androgenic hormone, dihydrotestosterone doesn't affect the hairs on the face, on the chest, or at the other side of the body. It only affects the top or the frontal or the vertex area. So this means that androgenic alopecia is related with the receptors of the hair that are present at the vertex area or frontal area of the patient. It has been observed that 5-alpha reductase enzyme level in both male and female is 2 times increased compared to normal patients. So androgenic alopecia is in fact directly related with the enzyme again. So this enzyme, the important role of the 5-alpha reductase enzyme in androgenic alopecia formation is very clear. And we also know that there are growth factors like insulin-like growth factors, or there are different growth factors. These growth factors are really very, very important for the hair loss prevention. With this innovation, today we are choosing the mesotherapy products that has got growth factors inside it. And for aging, it is very important. We know that in androgenic alopecia, especially for the woman, aging is really getting much more visible. Menopause is a really important time period for the woman hair loss. And the most common cause is genetic, which means that at the receptor level. So, is it enough to say our problem is genetic only? Okay, we understand it is genetic, but what we discovered today, let's talk about this point. Till now, is anybody that does want to ask any question, my dear audience? Do you have any question? Shall I continue? Okay. I continue. Here, my dear patients, whatever we say, okay, it's not only by word, but don't forget that. Let's take the patient history. Ask some questions to understand the story of the patient. Family story is very important. Stress level of the patient is very important. The medication that patient uses is very important. So what are the symptoms? Is the patient has got only hair loss? Is the patient has got itching? Is the patient has got dermal eczema at the scalp? So we need to first listen the patient. And then, okay, we know that androgenic alopecia is in general genetic. Dihydrotestosterone hormone is very important, and alpha reductase enzyme is 2 times higher in genetic patients. But don't forget that even it is woman or man, if there is iron deficiency, if there is zinc, magnesium deficiency, the patient will have severe and severe hair loss problem. The patient says you that my father is also has also problem with hair loss, but he was over 40, he started to lose hair. I'm just 20 years old and I started to lose my hair. Why I am not like my father? Why I couldn't wait till 40 ages or 50s? Because it is really an important point that nowadays in all around the world, we have got severe vitamin D deficiency. It is like, okay, we learned the pandemic with COVID infection, but we know that there is vitamin D deficiency pandemic all around the world. The sun is not as healthy as before. That's why if the patient has got vitamin D deficiency, then the androgenic alopecia appears younger. So if the patient has got biotin deficiency, the patient's hair loss problem is much more severe. There are some female patients are coming and say that, okay, my mother has got such a little bit hair loss problem, but it started with menopause. I'm just 30 years. Why it appeared that much early? So that's why I always highlight during my trainings that please, for the androgenic alopecia, don't say only genetic. We all know that it is genetic, but we are medical doctors. So we should see the patient's vitamin D level. We should see the patient's biotin level. We should see the patient's iodine level. And we should check hormonal system, the thyroid hormones, the woman hormones like follicular stimulant hormone, luteinizing hormone. We should check the cortisol hormone level. Okay, because when the patient's stress level is high, androgenic alopecia becomes severe. When the patient has got thyroid problem, androgenic alopecia becomes appears younger. So approximately all of us, all the medical doctors, everybody learned that iron deficiency is an important cause of hair loss. But iron is not enough. So you should check iron, and you should check iron not only on the blood, you should check iron also the storage, because the blood iron can be normal, but it can be close to the lower level. We all know that there's a range for iron. It is not a point in our blood. Let's say 30 to 150 of iron level in the blood is normal. If the patient has got 40, 45 iron level, then you can say that this iron level is between the range, so it is normal. This is normal for maybe carrying the oxygen, but it is not normal for the patient's hair. Because the patient has got androgenic alopecia, if the patient has got low level of iron, this iron will be used for carrying the oxygen. It will not come to the hair to create a new anogenic phase follicles. Or if the patient has got zinc deficiency or biotin deficiency, this doesn't mean that it should be very low. Even if the results of the patient's hair checkup shows you that, or the vitamin D level, for example, if they are close to the lower level between, we all know that vitamin D has got a range. Let's say 30 to 100 is normal in our laboratory. For vitamin D, they say that 30 to 100 vitamin D level is normal. Below 30 is deficiency. Over 100 is hypervitaminosis. But if the patient has got 33 vitamin D level, this is not efficient for hair. This vitamin D works for bones and muscles and other systems. So for hair, if you want to reach a successful result with your mesotherapy, please be careful that the patient's vitamin D, iodine, and biotin and iron levels should be optimal, not close to the bottom level. It should be, if it is possible, close to the upper level. Otherwise, you cannot be successful. I talk about all the hair checkup parameters. And now let's talk about what are the treatment options of hair loss, what is hair mesotherapy, how we can support mesotherapy with different applications. We know that hair loss main reason is genetic. Diseases can be a reason. Stress can provocate hair loss. Environmental factors and hormonal changes can be a reason. And we learn now the different phases of the hair follicle. And we know that scalp circulation is very important. We know that to decrease the scalp inflammation is very important for the treatment. So today, we know our target. We need to increase the number of hair roots that are at the anagen phases. But how? Let's talk about it. It is very common to use 5-alpha reductase enzyme inhibitors. It can be a choice. Why not? Because we know that the 5-alpha reductase enzyme is high at the androgenic patients. But we all know that when we increase the blood flow of the hair cells, we have got stronger results. And for a successful treatment, here we need to approach with 3 different ways. We should start an oral supportive treatment like biotin, vitamin D, magnesium, saw-palmetto, omega-3, or finasteride minoxidil. Also, we can start to use some instruments like derma roller, which is the main tool for microneedling. And as microneedling, now we know that it is very important to use low-level lead therapy. Now I will go in detail. And in the clinic, we can combine microneedling and low laser lead therapy with PRP, with mesotherapy, with exosome therapy, and with stem cell therapy also. Just as a point, I would like to highlight that when you are choosing an oral supplement, you see here, I'm very serious about the oral supportive treatment. Please don't forget vitamin D. There are many products all around the world, also in Istanbul, oral supplemental products for hair. All of the products has got biotin inside it. All of the products has got cysteine inside it. But what is important, it is vitamin D. So for the moment, this is the only product, hashash daily rooted product is the only product that has got vitamin D inside it. So please, my dear friends, if you are starting an oral supplement for hair, take care of the vitamin D. Choose a product which has got vitamin D inside it, or combine the hair supportive product with vitamin D treatment together. Otherwise, your hair vitamin supportive treatment will not work without vitamin D. So here we know that there are many options for hair treatment: minoxidil, finasteride, dutasteride. For the oral treatment, I prefer finasteride. I don't like the side effects of minoxidil and dutasteride, but I appreciate finasteride more than the others. And what I realized till today, because this is my more than 10 years, I'm concentrated on the hair treatments, hair loss treatments. I like hair mesotherapy. Hair mesotherapy has no side effect, and dermapen microneedling has no side effect. Low laser lead therapy has no side effect, but minoxidil can have side effect. If you want to start an oral treatment, please choose finasteride instead of minoxidil. Minoxidil can have really severe side effects like erectile dysfunction or cardiac vascularization problem. So I prefer microneedling, low laser therapy, platelet-rich plasma, mesotherapy cocktail, exosomes, and sometimes I use radiofrequency for microneedling. Now, let me share my experiences about this issue. Of course, hair treatment process can be finished with a hair transplantation. It can be done just before hair transplantation or after hair transplantation to support the hair. Don't forget the importance of microneedling and low laser lead therapy. Why I love that much focus on the microneedling? Because we have got evidence-based medicine. In 2020, there's a clinical study that is published, and it shows that microneedling promotes as an inflammatory process and acts on release of important growth factors in the hair follicle stimulation. So by itself, without any other product, making microneedlation, you see here, microneedle is very important, can cause the patient's hair roots to create more and more anogenic hair follicles. So this is very important, my dear friends. That's why in my 10 years experience, always and always, my first step is microneedling. It can be done with dermapen, it can be done with dermastamp, it can be done with radiofrequency. If the patient's at home, I always ask my patients to make their treatment at home. First step, derma roller. So microneedling is the first and very, very important step. So don't forget to start with dermapen. Don't forget to give your patients derma roller as a homework. So we know that microneedling and low laser lead therapy can be combined. Now, I would like to take your attention here. What is important today, my dear patients, what I realized, you can make mesotherapy or PRP in your clinic, let's say 3 times, or let's say 5 times, but you cannot, it's not that much easy for the patients to come to your clinic for 10 times, for 20 times. But we know that whatever we do for the hair, we need to continue this treatment for 3 months, which means that 12 weeks. So we need a treatment plan for 12 means. Sometimes once in a month, 2 times in a month, ask your patients to come to the clinic and make your mesotherapy with dermapen and low laser lead therapy. But you should give them homework. So as a homework, you should ask your patient to use derma roller, and you should ask patients to use low-level lead therapy with a product, with a special product that has got growth factors inside it. Look, this is a very important study that I would like to share with you. The combination of microneedling with low laser lead therapy with a special product, growth factors inside it, or with finasteride, how affects the treatment? In conclusion, we know that it has got really positive effects. Look, this is a multicentric, observational, retrospective, and case series investigation. Microneedling is used with low laser lead therapy, and the product with growth factors could be a booster for the patients who are using finasteride or who are not using finasteride. Here, I don't want to say you that stop finasteride and use only microneedling and low laser therapy with meso product. Combination is always a good choice for the hair loss patients. There are 20 patients, 16 of them are males, 4 of them are females, and in fact, 10 of the patients were taking finasteride, but 10 of the patients did not achieve good results with finasteride. So here in this study, we combined dermapen and low laser therapy with finasteride, or without finasteride, we had got the data with the result of these two products. Follow-up period is 20 weeks. It's a good time, huh? It's approximately 5 months. So, but we said we need at least 3 months, 12 weeks, 3 months. And in this study, we have got data for 20 weeks. So we here see that all the parameters, when we look at the parameters like number of androgenic follicles, how strong it is affected on the vertex area. We all know that vertex is the hard area that we can succeed. We have got really strong results. Let's look at the results here. Preoperative view of the scalp with HL localized in the frontal, temporal, parietal, and especially vertex area. 20 weeks after the treatment, here patient used derma roller and hair gain booster in the vertex area and the frontal area. And here we see that the telogen and anogen hairs were approximately 38 and 61, which means that the number of the hair roots that at the anogen phase increased, the number of the hair roots that at the telogen phase increased. This is very, very important for us. We have got, again, strong data for the 46-year-old male pattern, and also for the woman, 21-year-old female patient who didn't have good result. Here I write it wrong. Sorry for male. This is female. No, this is male. This is male. Sorry. This is male patient. So finasteride didn't work, but you can see the difference here. Microneedling and hair gain booster, and with a growth factor meso product, it is really a magic. So hair gain booster effects on microneedling with low laser lead therapy growth factors on subjects treated with finasteride. Let's see how is the result. So we can now, with science, evidence-based science, microneedling with low laser lead therapy using the product is efficient. So now I would like to show you how I use this product. This is the hair gain booster device. You can open it. Okay. And this is the product that I like, because inside this product, GENOSYS, this product, HR MATRIX, I like it because it has got growth factors inside it. You see, growth factors are very important. You can put this product, home mesococktail, inside the hair gain booster. And in fact, before you put it, you should apply the microneedling apparatus. Let me show it to you. Can you open it to me? Help me, please. There is a needling inside it. You remember microneedling was very important. You can ask patient to use extra derma roller, but you can also use the apparatus inside the box. It is very easy. You open the product and then you apply the microneedling apparatus. Now you have got needles at the upper surface of this flacon, and then you put this flacon inside the hair gain booster. Then you close it. This is the first device that we can use, that we can advise our patient. They can make both together, microneedling and low laser light therapy together. You see here, while the patient is applying this product to their hair, at the both time, they are making microneedling and they are applying red and blue low laser LED therapy. Now I can feel the product. After the training, I will finish this flacon for myself. Now let's continue if we have got any other evidence. There is another study. This is the same study's conclusion. We talk about it. This is another study that microneedling with low laser LED therapy, it is hair gain booster. You know the device probably very well. I use it for more than 5 years. And I also advise this hair gain booster device to my patients for home use. This time, you remember during the COVID time, many patients has got hair loss. So it was a severe problem after the COVID because the inflammation after the COVID was very strong in the body. So the patient started to lose hair. When they come to me, my first step was, let's do a hair checkup because I need to see how severe inflammation present in the body. I observed the inflammation, I treat the inflammation, I started oral supplements, then I made clinic mesotherapy. First, dermapen microneedling, then product injecting, flacon injection, and then low laser LED therapy, hair gain booster usage. So I did it in my clinic, but for a strong result, for a successful result, I was asking my patients to get the hair gain booster and the hair solution product at home. 8 weeks, once in a week, they were using it at home. Sometimes they were coming to my clinic and they were using it. And sometimes they were using the product weekly at their home. So by this way, my treatment was able to continue because whatever you do for your hair patients, it should continue for 3 months. Once in a week in my clinic, once in a month in the clinic, sometimes becomes very expensive for the patients. When I ask my patients for 8 times to come to my clinic and to take their treatment by myself, they say that, doctor, it is costing a lot. How can I continue at home? And then I advise them to buy this kit for home mesotherapy, home dermatherapy. They can rent it or they can come clinic to apply this treatment at clinic by our estheticians. By this way, the patients were able to have got a prolonged 3 months treatment, and they were getting more and more successful. Here you can see after COVID how the patient's hair became stronger and stronger, both for men and women. This was really amazing for me also, because I had got many patients. Once in a month, I was making their clinical mesotherapy, and every week they were coming for the application of the product by my esthetician. And if the patient has got COVID story in their past, I was also applying intravenous antioxidant treatments for them. Then the result was better and better. So I really liked to highlight you here, microneedling and low laser therapy combination with a growth factor rich hair solution is 90% brings you a success in your clinical practice. Okay, I would like to ask today you, is there anybody who has really a different observation regarding the hair gain booster and hair solution product? Could you write me from the chat box, because I talked a lot. Thank you for your listening. Now I would like to see the questions. Okay. There are some questions. Okay. Good morning. And now the first question is, dear doctor, did you mean that the hair treatment should be combined with vitamin? Yes, my dear doctor. It is a Turkish doctor probably. So this is the main step for my success, my dear audience. Always I combine clinical mesotherapy with the vitamin, but not only with the hair vitamin. I always combine it with vitamin D, and if it is necessary, with iodine. Otherwise, oral biotin treatment will not work. The patient should have got enough vitamin D and iodine in the blood. Otherwise, your clinical mesotherapy will not be successful. How often would you suggest microneedling treatment in the clinic? Okay, it is must, in fact, once in a week. However, the patient sometimes say that even they buy the package, doctor, it is too expensive. Please help me. What can we do? Here I say that for dermapen needling, come to my clinic when your budget is available, but because it is much more expensive. So if it is not possible to come every week for dermapen and injectable mesotherapy by medical doctor, please get this product and buy this product and come to my clinic, or buy this device also. If the patient's budget is available, I want patient to buy hair gain booster and hair solution together and apply at home. Because if they apply it at home for 8 weeks, and if they come to my clinic for 4 times, then this makes 12 weeks. So I reach 3 months treatment by this way. What regime would you advise? Is it clear, my dear friend, my regime? At least 4 times clinical mesotherapy in my clinic and 8 times hair gain booster and hair solution applied at home or in my clinic. Okay, is there any treatment for scarring alopecia based on lichen planaris? Lichen is the hardest part of the patients. I'm so sorry. lichen and alopecia totalis alopecia. For males, for females, lichen is not very successful. What you can do, corticosteroid treatment, moisturizing, but it's not, what I can say you for my lichen experience, don't make microneedling for these patients. From the starting of my presentation, I'm focusing on the microneedling with derma roller, derma pen, with hair gain booster. But for the lichen patients, never and ever use microneedling. This is the only advice that I can give you. And does more hair fall start straight after microneedling? No. If you use the correct device, my dear friend, you will not have hair loss after the microneedling. Just sometimes patients, can you bring me a derma roller? Okay, sometimes patients use derma roller wrong. If the patient has got a long hair, and if they make roller like this, it is impossible. Then their hair loss will increase due to the trauma. If the patient has got long hair, they just need to use the roller like this way. So to use the roller in a correct way, it's open here. Okay. Look. For example, my hair is long, and if I want to make it like this and with a strong way, no, it will make my hair fall down. So here you should use the micro roller like this, okay? Or sometimes you need to use derma stamp. And in clinic, always use the derma pen like this, not like this, okay? For the face, you can use the derma pen without getting up on the face and circular movement. But for the hair, when you use derma pen, when you use derma roller or derma stamp, you should make it like put. Touch and go up, touch and go up, touch and go up. Don't start to roll. Just use the needling part. Okay, there are some questions also. I haven't used GENOSYS. Yes, it's something I'm looking into offering. Okay, you will connect with the company. And what are the causes of scarring alopecia? I mentioned it on the PowerPoint presentation. Please find it after the presentation because GENOSYS is also recording the presentation. How do you know whether it is in telogen and anagen phase? What age can one start this? Okay, these are two different questions. Okay, without biopsy, you cannot know that these products are at the telogen phase. These products are the anagen phase. Just in every session, you cannot take biopsy. That's why here the observation is very important. And we have got special loop devices that shows us, but it is not easy to carry that device. Bizim bir tane loop device'ımız vardı ya. So, okay, you can look always at the same centimeter square with a loop device to see the hair roots nature, hair follicles nature. This is a point. But without biopsy, you will not have a certain result. So observation is very important. Patient feedback is more important than everything. Believe in me, when you make a good clinical mesotherapy with microneedling injection and low laser lead therapy with hair gain booster, and when you ask patient to use 8 weeks of hair solution treatment, at the end of 3 months, patient will say you that I'm not losing hair anymore. My hair loss stopped. This means that telogen phase is decreased, exogen phase stopped, and anagen phase is increasing. What age can one start this? In fact, over 18. I'm using for all of my patients. Can use hair gain booster for more than one patient at the clinic? This is a good question. Look, the hair gain booster, the hair solution product, bunun açılmamışını açar mısınız? This is, for example, for the name of the patient. This patient is buying this box, and inside the box, that patient has got own microneedle. So this box is only for one patient. Sorry, I'm opening it now. Okay, here you see there is 1, 2, 3, 4, 5, 8 weeks of flacon, but the microneedle belongs to the patient. This kit belongs to the patient. So this needle should be used only for that patient. So you can change the needle, and when you open this box in your clinic, you can use one patient with this needle. And what I'm doing here for this hair gain booster device, needle should be changed, but I like this device except the other red or blue devices. Why? Because it is easy for me to open it, to get it back, to clean inside, and also we are putting these two apparatus inside the disinfection solution. So, which means that we are making disinfection for these two parts. So, after each patient, I can clean the device and I can use it easily with a new needle. So, hello, doctor. Thank you for this. Thank you very much. Could you please explain the frequency of mesotherapy and low level how many times in a year? 3 months. Always, whatever I do, minimum 3 months treatment. In my clinic, once in a month or 2 times in a month, I ask my patient to, today I'm with my new colleague in Istanbul Hair Institute, Pelin. Can you say hello? Okay, me or Pelin, we are together in the clinic and we are making clinical mesotherapy with dermapen, injection, and low laser therapy, hair gain booster 2 times or 1 times in a month. And the rest, the patient can do at home or come to my clinic and it can be applied by our esthetician, by our colleagues. Could you please explain what derma roller should we propose to patients? Titanium derma roller, it should be a good brand. Okay. And how many times a week? How many milliliters? It should be 1 milliliter because our target is to reach to the hair bulb, hair root. So that's why there are different kinds of derma rollers, my friends. Some of them are 0.25, some of them are 0.5, some of them are 1 milliliter. 1 milliliter length of the needle is enough for scalp. Okay, without exaggerating, 2 or 3 minutes, microneedling every day at home is a must in my protocol. There is a question from Turkey. My Turkish colleague says that to apply a high dose of chemical product, is it dangerous? No, it's not dangerous. I ask my patient to use it once in a week at home. Hangi seanslarda gelmeler? And how often they should come to my clinic? Within 15 days intervals, 2 times in a month.
Başka bir kimyasala maruz kalması durumunda diye soruyor galiba.
Okay, maybe I couldn't understand my Turkish colleague's question enough. My dear friend who asked SA with the short name, saçın sürekli aşırı kimyasala maruz kalması sonucunda bu kişiler hangi zamanlarda seanslara gelmelidir? Biraz daha anlayabileceğiniz bir şekilde yazarsanız size cevap vermek isterim. I don't know the price. It depends on the country and it's not my topic. And there's a thank you message from one of my friends. Thank you very much. But there's another question regarding the hair message asked what I am thinking about the hair massage, hair scalp massage. My dear colleagues, not only for hair, even though we are medical doctors and we are making facial aesthetic applications like Botox, fillers, different and all kinds of mesotherapy, I do appreciate massage and face yoga very much because this is something totally independent from our medical applications. With the touch of the scalp to the right points increases the circulation of the scalp, and by this way lymphatic drainage and blood circulation will improve, and you will see that when you support it with the hair massage, hair scalp massage or face massage, scalp massage should include also the neck, my dear. And just a key point, one more key point, when you are making injection mesotherapy with your product in your clinic, don't forget to touch the patient's neck by your other hand. Here there are some acupuncture points. When you touch that points, you increase the scalp circulation. So you will have better results with pointing, massaging the acupuncture points of the scalp. You will test it. Home care solution contains a microneedle stamp. At home, the treatment can be done manually or with hair gain booster. I don't appreciate. Okay, Jerome, write this one. Yes, it can be done manually, but believe in me, with hair gain booster device, it is much more efficient. Do you recommend the patients use HR3 MATRIX product shampoo? Yes, but it depends on their budget. I also like their tonic, in fact. I know that they have got a tonic, especially if the patient has got a dandruff problem. Before the clinic mesotherapy, I use tonic and then I make mesotherapy. Price is another issue. Hello, how many times should the treatment in a week at home? Once in a week. Once in a week. Derma roller can be every day, slowly, and short while, 2-3 minutes, but hair gain booster with the product, hair solution once in a week. Again, Geogmi is giving some answers. Thank you, Geogmi, for your help. Good morning, doctor. What are the chemical components of hair gain booster? Hair gain booster is the name of the device, my dear friend. And hair solution, HR3 MATRIX, is the product that has very much experienced by me. All the vitamin, mineral, biotin, cysteine is inside it. Plus, there are growth factors inside it. You can take detailed information from the company. Hair gain booster cihazının egzama ve yağlanma problemi olan hastalar. Okay, there's another Turkish colleague asking me that if this device, hair gain booster device, can be helpful for the patient who has got eczema and or oil problem with the scalp, why not, my dear friend, but before starting hair gain booster, if the patient's scalp is very dry, first, it is in the point of marketing, they named this as hair filler, Helen, isn't it? But in fact, use a strong and good product rich from hyaluronic acid. First, moisturize the scalp with the mesotherapy rich with hyaluronic acid, then use this product, because with blue and red light, the inflammation will decrease and the circulation will get better. Oxidative stress at the scalp will decrease and you will have better solutions. One more question. Ask about use some device for many patients. I answered before. What pricing? It is not my issue. Thanks for explaining. Thank you very much for your participation. Can LED light therapy be used every day if patient has? Yes, why not? Why not? Why they are watching a film at home without product, they can apply it every day. Okay. There are some brushes now with red lights and low laser light therapy. So it is useful. Thank you. Thank you very much. Which one?
She asked, Veronica, so do you recommend that patients use HR3 MATRIX products, shampoo and tonic after
Yes, I
transplantation?
said yes, Jeanne.
And when can they start? And how long should they use?
Okay, in my clinical practice, hair young booster shampoo, GENOSYS shampoo, GENOSYS scalp shampoo, I like it very much. They can use it. First of all, I never advise my patient to wash their hair every day. So maximum 3 or 4 times in a week, they can use the shampoo. And for my clinical practice, in my clinic, I use hair tonic, GENOSYS hair tonic, especially for the patient who has got eczema. First, they should wash their hair, then they should use the product. So they can apply the HR3 matrix after they wash the hair. Okay?
Yeah, okay. So after hair transplantation, when they can start washing hair, anyway, they can
3
use
days.
GENOSYS products.
For all after hair transplantation, first day is the hair transplantation day. Second day is opening the bandage. Third day is the first wash day. At the first wash day, they can use the scalp shampoo.
Okay.
It is a very good and very beneficial shampoo. So there's no limit for using this shampoo after hair transplantation. If the patient's budget is available, ask your patient to use it as soon as possible.
Clear?
If it is okay, I would like to continue with my presentation. It's almost finished because okay. I'm sorry, there's my this is another way. As I mentioned with the questions, microneedling, injection mesotherapy, and low laser LED therapy with hair gain booster is my 3 steps that I follow during my treatment. When choosing a mesotherapy product, it's very important to nourish the hair roots, stop the hair loss, and to stimulate the growth of the hair follicles. We know that vitamins, minerals, amino acids, and peptides are very important. okay, we just focus on the biotin vitamin, but in fact, there are other vitamins which is very important for the hair growth. And the minerals are very essential for the hair growth. And glycine and cysteine amino acids are very important for keratin. So choose the product which is rich from cysteine for your mesotherapy. Peptides are very important because copper tripeptide, octapeptide, oligopeptide, acetyl tripeptide are really, really very effective to slow down the effect of alpha reductase enzyme. So 5-alpha reductase enzyme can be blocked by copper peptide. There are clinical data about these claims. So cell booster is a good choice, which is rich from cysteine and biotin. You see that it has got a good hyaluronic acid compound, rich from the vitamins and amino acids. You see cysteine is here, and biotin and niacin is here. So you can use during the clinical mesotherapy. And with micropapilla, you can apply it to the scalp. I like it. You remember, for the seborrheic dermatitis, eczematic lesions on the scalp, I ask you first to use a mesotherapy product rich from hyaluronic acid, then to use the hair gain booster. So here again, you should combine hair gain booster with a mesotherapy product. And we know that growth factors are very important. In one session, you can use a good product, rich product from niacin, hyaluronic acid, and biotin. And the next session, you can use a product rich from hair growth factors, because we have got good scientific data with the hair growth factors. So this is, here is the compound of the product, home product, HR3 MATRIX solution. One of my doctor friend asked for the compound. Here you see it has got many tripeptide, polypeptide, growth factors. These are growth factors, IGF, TGF. These are strong growth factors that is inside the HR3 matrix that you can use at home for mesotherapy. And it is a rich product also for plant ingredients. And this is my presentation. I would like to thank you all. As a conclusion, hair is the most visible and striking characteristics of our body. It's very important component for the psychology and feeling beauty, not only for us, also for the childhood. For this reason, hair loss is a serious problem, can be, and in fact, it is a serious problem for both men and women. So let scientists to research and develop hair loss treatments more. By this way, we as a medical team and our patients will be more happy. I would like to thank to all of you, my dear. Do you have any question that want me to answer again?
Yeah, Dr. Handan, there is the last one. Yeah, how long after hair transplantation can you use microneedling?
1 month.
1 month.
Because it takes 1 month, sometimes 3 weeks. It depends on the patient's scalp quality, circulation, but the channels that we open during the hair transplantation should be closed, and at least 1 month I'm waiting for the micro needling.